Good evening.
Good evening.
Hello, I am Dr. Muhammad, one of the surgical doctor. May I confirm your name and age, please?
Hello, doctor. My name is Johnson, and my age is 65-year-old.
Nice to meet you, Mr. Johnson. Today I will be your doctor. Is that okay?
Yeah, that's all right, doctor. I'm not able to wee, doctor, for the last couple of days, and this is this problem that I've been suffering for a couple of months now, and it's really getting worse and worse now.
I'm really sorry to hear that, Mr. Johnson. Okay, Mr. Johnson, when was the last time that you bath urine?
It was last day, you can say 24 hours ago.
How about your health been recently?
I'm okay, except for this urine problem that I'm not able to get out.
Don't worry, we'll take care of you, Mr. Johnson. Did you notice any unintentional weight loss or general tiredness?
No.
Okay, Mr. Johnson, do you have any back pain?
No, I don't have any back pain, no.
Do you feel any numbness or weakness in your lower limbs?
No.
Any tummy pain or tummy swelling?
I think I have tummy pain, but I think it's from the urine being like filled up inside my bladder, right?
Right. Have you had a fever, Mr. Johnson?
No.
Do you have any pain with urination?
Pain with urination? I don't have pain, but the urine is not getting out. That's the issue, doctor.
Do you have any trauma in your growing area recently?
No.
Okay, Mr. Johnson. Do you go to the loo more than usual?
I go more than usual, yes, in the last month, but when I go there, nothing coming out, or it will be just dripping.
Okay. Do you wake up at night to go to the loo?
Yes, couple of times.
Okay, Mr. Johnson. How many times you go to the loo?
Around like 3 or 4 per night.
Are you able to hold your urine?
Yes, I'm able to hold my urine, yes.
Okay, Mr. Johnson. Do you have any difficulty to start your urination?
Yes, it's very difficult to start my urination, yes.
Okay, can see. Mr. Johnson, during urination, do you take long time to empty your bladder?
Yeah, I think I take more than usual, yes.
Okay, Mr. Johnson, do you have any dribbling?
Yes, I have dribbling at the end of my urination.
Did you experience similar symptoms in your past?
Yeah, as I told you, for the last 7 of months, this was an issue ongoing in my life.
Are you diagnosed by any medical condition?
No.
Is there any one of your family experience similar symptom or diagnosed by other medical condition?
I think, yeah. My father had prostate cancer, and he used to have problem with his urination too.
I'm sorry for your father, Mr. Johnson.
It's okay, doctor.
Have you had history of surgery or hospitalization?
No, I don't.
Do you take any regular medication, Mr. Johnson?
I don't take regular medication besides paracetamol for headache.
Do you have any allergy?
No.
Mr. Johnson, I want to ask you a personal question. Is that okay with you?
Yeah, that's all right, doctor.
What do you do for a living?
I'm a car dealer.
Who live with you?
My wife and my youngest daughter.
Nice to hear that. Do you smoke, Mr. Johnson?
Yes, I do.
How many cigarettes per day?
10 to 15 per day.
Do you drink alcohol?
No, I don't.
Okay, Mr. Johnson, what do you think the cause is?
I'm not sure, doctor, because as I told you, my dad had prostatic cancer. I'm afraid that it's the same.
Don't worry, we will take care of you. What's your expectation from us?
Treat this problem. I really want to get back to my normal life.
Okay, Mr. Johnson, did you experience any chest pain or shortness of breath?
No.
Any joint pain or swelling?
No.
Okay, Mr. Johnson, we have reached our end of questions. You have been so cooperative. Thank you so much.
Thank you, doctor. It's my pleasure. Okay, doctor, can you present your patient, please?
I took clinical history from this gentleman, 65 years old, presented with urine retention 7 months ago and getting worse in the last 24 hours. He has hesitancy, frequency, and low urine stream and urgency. No symptoms suggestive of malignancy or neurological symptom. No hematuria and no dysuria. So my main diagnosis is benign prostatic hyperplasia.
What's your differential diagnosis?
I will consider prostate cancer, bladder malignancy, overactive prostate, UTI, and renal cancer also.
All right. And how will you investigate this patient?
I will start by transrectal ultrasound.
Okay.
Also, I will consider blood investigation as prostate-specific antigen and urea and electrolyte and full blood count.
Full blood count. Okay.
Also, abdominal ultrasound.
Abdominal ultrasound. Okay. You said prostatic specific antigen, right?
Yes.
What's the causes of increased prostatic specific antigen?
Benign prostatic hyperplasia.
Okay.
Prostate cancer.
Okay.
Infection as prostatitis.
Okay.
Also, increased age and after ejaculation.
After ejaculation. So it's not like a specific test.
Yes.
What to do if the BCA is increased? What's the next step?
Okay. I will measure the total prostate specific antigen.
Okay.
And free prostate specific antigen, and I will take the ratio. If lower ratio, it indicates that patient have prostate cancer.
Okay. What's the normal range of BSA?
Less than 4 nanogram per ml.
Less than 4 nanogram per ml. Okay. What is the free BSA?
Free BSA is floating of prostate-specific antigen in the circulation without bound to the protein.
How will you manage this patient, doctor?
We have medical treatment and surgical option. The medical option include give the patient 1 alpha blocker or 5 alpha reductase inhibitor.
Okay, give me the example of each.
1 alpha blocker as tamsulosin and 5 alpha reductase inhibitor as finasteride.
Continue your treatment. What else?
Okay, the surgical option include transurethral radical prostatectomy.
If the patient is taking phenylephrine, will that affect your management? And what about salbutamol? So salbutamol and phenylephrine, how they will change your management?
Phenylephrine is alpha agonist, so it antagonizes tamsulosin, while beta blocker is beta 2 agonist, so it will not affect the management.
Salbutamol is beta 2 agonist. Okay.
Yes.
That's all. You can go to your next station.
Thank you so much.